Hi there, I'm Cindy. This is Joy and Bella Chica. Bella Chica teaches with me all the time. She is an expert in aromatherapy. Her specialty is chemistry, and she helps me she helps me. She does. She helps us a lot, actually. So we're here at Stillpoint Studies, and today we're going to be talking about using essential oils to work with any kind of physical pain. So there have been many times, I am sure, in your life, or someone that you know of, who's had physical pain. An ouchie, a hurt, a fall down. There are lots of different times when we have pain. Even headaches is a pain that we all pretty much experience. So I think you can pretty much relate to physical pain. And today we're going to talk about using certain essential oils with physical pain.
And we're experts on physical pain because we're massage therapists. So we have worked with people, thousands and thousands and thousands of people over the past 13 years that come in with all types of physical pain.
For example, I have one client that I've been seeing for years and years. She didn't know that she had some kind of a diagnosis, but she would come to me and this joint would hurt and this joint would hurt. So in the back of my mind, I kind of knew that there was, something lingering, some kind of inflammation. And of course, I always use tons of essential oils like many massage therapists do in my massage practice. So I would use certain essential oils with her, and she actually became one of my case studies. So, we all wash our hands how many times a day? So I made her this foaming hand soap. First of all, it smelled really great, but in the back of my mind, I was choosing specific essential oils to put in that foaming hand soap so that when she washed her hands, every single time she washed her hands, she was getting that dosing of essential oils and clean hands, and smells great.
What oils did you put in it?
So I think in her foaming hand soap I used spike lavender, I used spike lavender, black spruce, and I think I used geranium because she just needed some kind of an uplift. So there was definitely an emotional component, but I was focusing on her pain in her hands. And she loved it. It definitely worked. I did make her some other blends to use topically, and we'll get into that later.
So did she get a diagnosis?
She finally did. She was diagnosed with rheumatoid arthritis.
So there are many different terms to describe pain in aromatherapy, and there's confusion about it. So if you use the wrong essential oil for a certain condition and it doesn't match, then the oil doesn't work, and then people just think this is all a bunch of nonsense, which isn't true. So Cindy's client had rheumatoid arthritis. And so anytime there is itis attached to something, that means there's inflammation. So rheumatoid arthritis is inflammation of the joints. And colitis is inflammation of the colon. And sinusitis is inflammation of the sinuses. And gingivitis is inflammation of the gums. So if people have any kind of inflammation, then you want to be looking at an anti-inflammatory oil. And that will reduce the pain, reduce the inflammation, and reduce swelling.
She definitely had a lot of swelling in her joints.
And so a lot of the times when you're dealing with any kind of inflammation, it's good to choose oils that are cooling. And so some oils that are really good for inflammation are, Balsam Copaiba is good for inflammation. Juniper berry is good for inflammation.
German chamomile is one that we use a lot in massage. It's tricky to work with because of that blue-green color, and some people really don't like the aroma very much.
And if you use too much of the blue color, then your client looks like a Smurf. And that's happened.
But it's a great anti-inflammatory essential oil.
So the next type of pain-relieving oils are analgesics. And analgesics reduce pain. And so muscular pain, you would use that for. So there's Ply Central, which is a fantastic oil. It's like magic. They did a study in Switzerland where they did a 2% blend of Ply, and they rubbed it on people that had arthritis, muscular pain, spinal issues, and the people had 16 hours of pain relief, no pain at all.
Some people may not like the aroma of Ply. It's kind of earthy and really we had somebody who actually said it smelled like dirt.
But
it comes from the ginger family, so I love the aroma.
And it's better to use than ginger because ginger can be hot and ply isn't. You even could use ply neat, but we'll talk about that later.
So some of the other therapeutic terms, what are they?
So, well, also another great analgesic oil is birch. And we'll also talk about birch later, birch wintergreen, because it has safety issues. But if you know how to use them properly, they really are fantastic oils.
Birch and wintergreen, both, they're very similar, and you can choose one or the other because they both contain methyl salicylate, like almost 98%, right?
Yep, and methyl salicylate is a precursor to aspirin. So if someone is using aspirin for a blood thinner or on Coumadin, you wouldn't use birch with them at all. And birch never, ever should be taken internally.
Ever.
So another term is anesthetic. And anesthetic means a numbing. So your sense of touch is removed so that way you could have some kind of healing. So oils that are anesthetic are clove bud and cinnamon leaf. And clove bud is anesthetic because it's about 98% eugenol.
In the old days, dentists used to use that. When I was a kid, I walked into the dentist's office. It smelled like clove bud, and I never really understood why.
Yeah, and so yeah, when we were kids, that's like the age of the dinosaurs. So when we were kids, anyway, so my dad was a doctor, and he said that the dentists are really the ones that should be credited with the discovery of any kind of anesthesia because it's completely numbing.
That's really neat.
And if you have a toothache, you can take some clove bud on a Q-tip and you just put it on your teeth, neat, but not on your gums. And don't let your tongue touch it because then your tongue is going to be numb. And that could help you get rid of your toothache until you can get to the dentist.
Right, not for long-term use, people.
Right, not for long-term use. And if you do put it on your gums, then the gum, you're going to get like a little ulceration or a burn.
It can be overused. So just make sure that you know the safety considerations for each of the essential oils before you start playing around with them.
But if you're scared to do that, then you won't use clove bud and you'll miss out on all of the fantastic properties of it.
So what's the last therapeutic term, Joy?
The last therapeutic term is antispasmodic. And so antispasmodic oils, they relieve spasms and cramps. And so people think, though, that you would use an antispasmodic oil like Roman chamomile just for, like if you have cramps from bellyache or
any kind of cramps.
Yeah, any kind of cramps. And so, and any kind of spasms in the muscles. So if you go running, you would put it on for any kind of cramping. But also, it's really, really good for any kind of spasm within the respiratory system too. So if you have a bad cold, bronchitis, and you have that cough that just coughs and coughs and coughs, if you use Roman chamomile or let's say bergamot with eucalyptus, then you get the respiratory benefit of the eucalyptus and you get the antispasmodic effect of the Roman chamomile.
So here's one of my personal stories, right? I was doing a massage with a client, a really long one. I think it was either a 2 or 3 hour session. And I was just, that bronchitis where it kind of just lingers, the cough just lingers. And you can always tell when it's going to start because you get this tickle. And I would get this tickle like really like deep into my lungs. And I felt it coming on. And in my massage room, I like to set the atmosphere and the tone where it's quiet and the music is playing and the diffuser and everything has to be just perfect, right?
Just perfect.
So about an hour into this massage, I feel the tickle start and I'm like, oh no, what am I going to do now? So I have my oils on display there, as that I use and whatever, and I just picked up Roman chamomile and I just inhaled it, took the cap off and just inhaled it because I didn't have any time to make a blend or anything like that, so I just sniffed. That little tickle, it just completely went away. And as I was able to then soothe myself saying, okay, I can get through the next hour, 2 hours of this massage without having this coughing spasm continue on.
Yeah, that would have been not good.
No, not good at all.
So, okay, so you name one of your favorite analgesic oils.
Analgesic.
Yeah.
Well, I have to say, I love lavender.
That's nice.
What's one of yours?
Oh, let's see. So one of my favorite analgesic oils is Balsam Copaiba.
Oh, it's lovely. Why?
Because it's calming and cooling, and actually one of the reasons is because Balsam Copaiba it's distilled from a resin, and anytime that you use an oil that is distilled from a resin, it helps heal old wounds, old emotional wounds, just old deep healing wounds. Because when you get an oil that's distilled from a resin, what they do is they cut the tree, and the tree bleeds, so to speak, and the sap comes out. They let the sap harden, then they collect that and they distill that. So the energetic property is it's equal. So the resin saves the tree's life, so to speak, and heals that deep wound. So it does the same thing for us, emotionally and even physically. Resin oils are great for skin.
That's kind of like we have these pinyon pine trees here in Sedona, and when I'm on a hike, I'm always seeing the resin on the tree. And I remember hearing the story about how the natives used to use the resin on any kind of gum inflammation.
Yes. But you have to be careful, because if you take the resin and if you do put it in your mouth, then it's going to get stuck on the roof of your mouth, and it's very difficult to get off.
Like gum.
Like
Stuck.
gum.
Stuck gum.
So do you remember when we went hiking in West Fork?
I do.
You remember what happened to me?
You fell down.
I did. I fell down. So we went hiking in West Fork. It's up the canyon, and I had my little dogs, not Bella Chica. I had Jasmine and Rosie. Maybe you'll meet them one time. And so I was holding them, and we were walking out of West Fork. And we were right by a little riverbed, and it just was like two hands grabbed my feet, and I just fell forward onto my knees because I couldn't let the dogs go, you know? And so now I'm embarrassed. So I'm looking around, and there are a lot of people there, and no one even asked to help me. You felt like you were in the city, New York City, because no one, it's like they looked at me and they kept on going. So Cindy helped me get up, and then she had in her backpack black spruce.
I always carry oils with me.
And so you see, when an emergency happens like that, you don't have time to go make a 1 or 2 or 3% blend. You just have to use what you have. So she put the black spruce neat on my legs, and we came home.
Both knees look really bad, by the way.
And so I thought that I would be able to milk this, you know, and like really kind of get mileage out of this injury.
Sick days?
Sort of. And so anyway, so so she put it on. I went to bed. I woke up. Nothing. No milking. No, I had to go to work the next day.
It was pretty amazing because both her knees had already started to turn, you know, that purple blue kind of color. Next day, there was no bruising.
No bruising.
Pretty amazing.
So, so the thing is though, so that you would do in an emergency. But if you were going to make a blend, then you would consider the oils that you're using, and you would also consider the carrier oils.
So, speaking now of carrier oils, so a carrier oil is what you're going to put your essential oils in. Some people like to use lotion. Joy loves to use that unscented lotion.
I love lotion.
That's her favorite carrier.
Yeah.
There are times, though, when an oil would be a really good choice. And I know you probably all have your favorite carrier oils. You know, some people like fractionated coconut oil. Some people like one of the infused herbal oils. And also you could use a salve. Salves are something that you make with cocoa butter. So you have, it's a harder substance, and it's time released. So when you use a salve to apply topically for any kind of pain, you're gonna have like a time release action. It's gonna last a lot longer. But if you want something that works and absorbs really quickly, go for Joy's favorite, which is the unscented lotion.
Yep, so the reason why it absorbs really quickly is because it's water-based. So if it's a good unscented lotion, then you're not competing with the scent of the unscented lotion. And so your blend will smell exactly as you prepare it in the lotion. And if you have any kind of muscular issues, that's what you would want to use, because you want the absorption to be quick into the skin. So that's why you would use a lotion for those kind of injuries. And if you had a cold, you would make a salve, because you would make, let's say, a salve with eucalyptus, fregonia, maybe Roman chamomile, a little bit of sagebrush, and you would make that into a thick salve, and then you would rub it here, just like you would rub Vicks Vapor Rub. And when you apply something like that, you're really not applying that to get into the system, you're applying it for the aroma. and to help clear the sinuses and stuff like that.
One of my favorite carriers, though, to use for pain and in massage with my massage clients is what we make here is an anti-trauma oil. What that is, it's an herbally infused oil. I love to use olive oil because everything that I've read, I'm not really an herbalist, but everything that I've read, olive oil is the best carrier, the best oil that absorbs those therapeutic benefits from the flowers. And we're actually going to be making our anti-trauma oil and make a blend using that, because sometimes actually I don't even use essential oils in the anti-trauma oil that I make, because those flowers have such great therapeutic benefits on their own. So you don't even need to like load up your blend with essential oils. You can just use one of the carriers, like one of the herbally infused ones that we're going to make.
Some people would rather use jojoba. It doesn't absorb the qualities of the flowers, the benefits of it.
We've had some students who've actually used jojoba as the base when they make their herbal infusions. It's probably really great because it doesn't contain that olivey aroma, but everything that I've read, like I said, the olive oil just kind of soaks it in and takes all the therapeutic benefits from those flowers and makes the carrier even more potent.
And so if you pick the right carrier with the right oil, you amp up you just amp up your blend and it'll be way more effective. The thing though that you have to be careful about carriers is some of them are smelly to me. First of all, you have to either get past the smell of them or you have to take that into account when you're blending. So for instance, a great carrier oil is tamanu or faraha. It's a pretty green or a pretty dark brown green color, and it really.
I love that.
You do.
I do.
Yeah,
I love it.
She loves it. And so it really is though, it's smelly. So one time I was making this blend but it's great for scarring. One time I was making this blend for a client and she had big scars on her face, and so she said, I want you to make me a scar blend. So I made this really fantastic smelling scar blend. I used Helichrysum italicum, cistus,
All the skin ones, right?
Divana, Pomarosa, carrot seed. I mean, it was fantastic. And so I mixed that into the tamanu, and it was just, it was gross.
Joy doesn't like nutty aromas. I love nutty aromas.
So
in an oil and in nuts to eat.
So I said to the girl, I said, and this is the difference too, you want to know your client or you want to know whoever you're making something for, because I said to the girl.
Really important.
Yeah, I said to the girl, it stinks. And she said, I don't care if it stinks. She said, I need to get rid of the scars. So she was compliant and she would use the blend.
She took pictures and sent us pictures actually as the scar decreased in size and intensity, and we were pretty amazed.
We were amazed, yeah.
Joy became a nutty aroma carrier lover after that because of the therapeutic benefits.
Only to make it for other people though.
So just consider that when you're making your blend for pain, what kind of carrier you like, or more important, what kind of carrier, if it's for somebody else, they like. And if they don't like those nutty aromas like Joy, don't use them. You can use something that has no scent, like the unscented lotion, or what's your favorite?
Unscented lotion?
No nutty aroma.
Oh, I like jojoba and safflower oil, sunflower oil, no aroma. So whatever your oils smell like, that's what it'll smell like in the blend. Before you decide on what blend that you're going to make, there's something else that you have to think about. So let's say somebody has a backache. So someone comes with a backache, lower backache. And so you say, okay, what am I going to make this person? So you say, well, maybe I'll make something that's analgesic and even a little bit anesthetic. So you say, okay, I might use ply, maybe I'll use some birch, maybe I'll even use some peppermint and clove. So you have the analgesics from the ply and the peppermint and the birch, and then the clove is really the anesthetic, and so peppermint has a little bit anesthetic quality. So now you make that and you put it in anti-trauma oil. You make it at a good clip, so let's say between 3 and 5%.
That's her dilution, by the way, when she calls it clip.
Yeah, good clip, right? Between 3 and 5% dilution. And so then, so now you give it to the person, and it works sort of. But the thing that was missing is the vibrational cause or the energetic component of it. Because if you have 3 people that have the same backache and you ask person A, how does this make you feel? And they say hopeless. And you ask person B, and they say, how does this make you feel? And they say angry. And if you have person C and say, how does it make you feel? And they say,
how does the pain make you feel?
How does the pain make you feel? They say worthless. So now you have 3 different emotions that are adding to this pain. So you really want to make sure that you also include oils that will address that.
So we're going to go through a blend later on. We're going to make a blend with you guys. But what we really do, we ask every single client in an intake, what is it? What's that emotional piece? How does it make you feel? And if you can add and address that feeling component by adding an essential oil that might help address the hopelessness or the anger or the, what was the other one? Worthlessness. If you can add another essential oil into that blend, it's going to amp up and it's going to be more effective.
So, okay, so then what oil would you add for hopeless?
Hopeless. My goodness. Helichrysum Italicum.
Why?
Well, there's the story about how helichrysum grew all. It's this tiny, beautiful little yellow flower, and it just conveys hope for me.
Okay, and what about worthless?
Worthless. That's got to be laurel leaf. Courage, strength, power.
So there's a neat story with laurel leaf. So back in the day, when the men would go out into battle, they would wear crowns of laurel, or they would beat their chest with laurel branches. Why men do that, we don't know, but they would beat their chest with laurel branches, and the idea was so that they would infuse their aura with laurel leaf. So laurel leaf on an energetic level is used for courage and bravery and moving forward. And actually, travelers used to put bay laurel in their shoes as they went on their journey for safety. Isn't that neat?
Neat folklore.
Yeah, I better get it.
Great story. Yeah. So what oil to you would you use to address anger?
Well, it depends on the anger, right? So there's 2 types of anger, in my opinion. There's anger itself, and then there's anger at someone else. And so if it's anger at someone else, oftentimes if you push it down, it's all you're doing is pushing it down, and it's going to erupt later on. So sometimes with anger at other people, you want it to burn out like a forest fire. And so for that type of anger, I use oils that are hot, and that would kind of like feed the flame, like cinnamon bark or ajuan, oregano, black pepper.
Ginger, maybe even?
Yep. And then for anger itself, you don't really want to beat yourself up and let it burn itself out. So that type of anger, that kind of forest fire you want to put out. And so I use cooling oils for that, and flower oils. So oils like peppermint, spearmint, rosewood, those are all cooling oils.
Like an aldehyde, maybe even like lemongrass would be great.
Yep, lemongrass is good, or melissa, and that all helps bring it down. And the flower, rose, white ginger lily, and that would just help with the self-love. Another term that we use in aromatherapy is analgesic. And analgesic means reduction of pain. So oils that you would use for pain relieving would be birch, ply.
Birch or wintergreen, because you're going to have the same kind of effect with either birch or wintergreen, because they're both methyl salicylate, 98%, I think.
It is, and methyl salicylate is the precursor to aspirin.
Today, we're actually going to address 2 different kinds of pain, because my client that I talked about in the beginning with the rheumatoid arthritis, that's a tongue twister there, she had chronic pain. So she had pain. She would wake up with the joints being really like swollen and achy in the morning, and it would happen during times of day, but it was more of a chronic pain, which means it was just like ongoing and it was long term.
Chronic pain is long term, and acute pain is like what happened to me. I fell down.
At West Fork.
And so acute pain is very sharp and it's very fresh. Sometimes acute pain, though, turns into chronic pain. And so if you're working with someone that has acute pain, and if it turns into chronic pain, then your dilution ratio of your blend is going to change with the change in the pain. So many people blend at 1, 2, or 3%. And so the general rule that you see is 1% would be for children, pregnant mamas, and elderly people. 2% would be for normal, regular people.
The so-called normal, you know?
Like healthy people,
Right.
no meds or anything like that. 3%, you'll use it for what some people say is the acute pain, which we don't find to be necessarily true, honestly, because if somebody has acute muscular pain, 3% blend is really not going to do anything. You really do want to start looking at higher dilutions, 5%, 7%, even 10%. But you can't blend that way unless you either get certified or you have some advanced training. The analogy would be like this. If someone came in with their arm cut open and you handed them a Band-Aid, that's the exact analogy of someone having an acute pain and you've been blending at 3%. It's just not going to take care of it. As the pain reduces, then the dilution ends up reducing too.
So the thing to really think about and consider, and that we do this with all of our massage clients, aromatherapy clients, it really doesn't matter. You really need to do some kind of an intake. You know, sit down with them, either fill out a form. If you don't have one, there are some really great ones online that you can look for. But really get to know get to know their general health and well-being, how old they are, if they are taking any kind of medications, you know, what's their stress level, things like that to consider before you actually start making a blend and saying, okay, you have a diagnosis. Here's the diagnosis, right? Rheumatoid arthritis. And now I'm just going to go straight ahead and blend. No, really take the time and get to know the person a little bit. Listen to them and hear what they have to say. And don't forget to ask them before you blend whether they like certain essential oils or not. And the same thing with the carriers that we were talking about. If they don't like nutty aromas, don't make it into Manu.
No, and you need to know the therapeutics of the oils, and you need to know the safety of them, because you know, people know that like mugwort is dangerous and thuja is a no-no. We don't feel that way though, but a lot of people do. So if you had, let's say, a pregnant mama come or a breastfeeding mama come, you would think that like myrrh is safe, and it isn't, and carrot seed, and it isn't. Those oils really shouldn't be used with that because there are different components that are in them.
So getting a safety book, you know, some kind of a book that talks about the safety considerations with essential oils, it's always good to have on the shelf.
Yeah, we recommend Tisserand and Young, Robert Tisserand's book. It's a good book.
It's heavy and it's expensive and it's big, but it's a really good book to have as a reference. I'm sure that you've had headaches, right? We get a lot of people that come to see us who have migraines, and they don't really want to be taking any kind of prescription migraine medication. Joy and I make this really great blend that seems to work really well for people. Like we had one lady come into the store with a migraine, and so I mean she looked like she was suffering. So she said, "Do you have anything for migraines?" And I said, "Yeah." I said, "We actually make this blend." So I went in the back and I whipped up a little stock bottle of 3 different essential oils that we usually use: frankincense, Palo Santo, and peppermint.
And it goes like this.
This is Joy's blending.
Frankincense, Palo Santo, peppermint. That's the ratio.
So everybody says, how many drops, right? That's how Joy does it. She looks at, she eyeballs,
Yeah.
right? So I made up this little stock bottle for the lady, and when people come in the store, they spend a while, you know, looking and smelling and tasting and whatnot. Not tasting.
No, some of them taste.
Oh, well, that's true. Smelling, basically, is what they do. But we have almost 400 oils, so there's a lot of smelling that happens.
A lot of smelling.
So I left her alone. I made up this blend, and I told her how to apply it. She says, "What do I do with it?" So back here on the occiput, back on the back of the neck, she puts some on the back of the neck, and she puts some on her temples, right here.
And you could put it here, and you put it on neat.
So she just took this, and she was there maybe 15 minutes, and she's calling from the front room. And so we go out front, and we say, "Yes, can we help you?" And she said, "My migraine is gone." She says, "What did you use?" So we told her the oils that we made the blend with, and she said, "I'd like to buy those oils."
And off she went.
So she was a tourist. She was here in Sedona. We get a lot of tourists here. And she took them back home to California, and she made the blend for herself. And a week later, she called and she said, "Could you make that blend for me?" And we were like, but you just bought those oils. Why do you need us to make the blend? And she said, I don't know. She said it was the way it was formulated or whatever. And that's the energetic piece as well. So isn't it always nice when somebody creates and makes something for you?
Like going out to dinner.
And so she wanted us to make this blend, and we did. We sent it to her, and it helped her migraine immensely.
I think there's an energetic component to that blend, really, because when you look at the oils used, you don't usually use frankincense for a headache. And Palo Santo, I think, is effective because it has an ether component in it, and ether is like mind expanding in a good way. And then the peppermint is what people traditionally use for headaches, peppermint or cornmint. But all three together, I think, makes a synergy. I think it creates a synergy of the analgesic property, a little bit of the anesthetic property, and then a protection property, because frankincense and Palo Santo are considered holy oils. Frankincense in Somalia and Palo Santo in Ecuador. Those oils are like white sage to the American Indians here.
And so another common pain that we deal with as massage therapists is back pain. A lot of times,
A lot of back pain.
Yes.
And so back pain, when we usually work with back pain in a massage, we usually do blend a little bit stronger for during the massage, and then we'll send our clients home with a lighter dilution. So if we use 5% in the massage, we'll send them home with maybe a 2 or 3% blend to work with at home in between sessions.
I mean, typically we're looking at essential oils that are going to be anti-inflammatory. And generally, we tell all our students when they're studying for their test, you know, because we ask them, name 3 oils that are anti-inflammatory.
It's a hard test.
It's a hard test. But so many essential oils are anti-inflammatory. I mean, we mentioned a few before, but I mean, you might even have your favorite that we didn't mention. So just think about the therapeutics terms that we went over with you guys. Anti-inflammatory for back pain. I love black spruce. Spike lavender and black spruce together are really beautiful. And don't forget ply. Ply is the premier oil that massage therapists use in Thailand.
Yep.
That's where the oil comes from.
And then, what about cramps? Menstrual cramps. So, well, this is kind of a good story. So we had a client come over with 2 of his friends, and so they sit down on that couch in my therapy room, and he's talking to me, and one of the girls is mopey and whiny and complaining, and so she said that she has menstrual cramps. So I said, I can give you an oil that'll help you. And she didn't believe in oils at all. So these are really great stories when the person that you're working with just doesn't even have any faith. So I gave her Roman chamomile, and I told her to rub about 5 or 6 drops of Roman chamomile on her belly, neat, and see how it feels. And within 10 minutes, she's like, oh my goodness, can I buy some because my cramps went away?
It works pretty quickly, it really does. It's great anti-spasmodic oil.
And other oils that are really good for spasms are ethers. And ethers are, it's a chemical family that you really need to know how to use. They're quite powerful. Actually, ethers are like esters on steroids. They're highly, highly antispasmodic, and you would use them at a very, very low dilution. And the ether-rich oils, they smell like licorice. So exotic basil, fennel, aniseed, caraway, those all are high ether-rich oils, and they should never, ever, ever, ever be used with kids or with pregnant mamas or breastfeeding mamas, ever.
I think tarragon is in there too, right?
Tarragon.
Yeah. We often recommend to our clients using heat or ice at certain times. Ice is a great anti-inflammatory, so applying ice is going to help bring down any kind of inflammation. And there are essential oils that have that cooling anti-inflammatory effect as well. I love using peppermint in a lot of my blends, and it really works for me. It works for me for headaches, and it works for me with pain. Because I remember, I ran the marathon a few years back, and the joints and your muscles and everything just feels like really hot and used and overused, and it was. And peppermint is just one of my favorite essential oils to use for any kind of heat that I need to cool down?
I would never, ever run a marathon at all. So one of my favorite oils for that is corn mint. And corn mint is, it's mentha arvensis, and it's much colder than peppermint. So it has more of an anesthetic type of effect also. And so I like that in any kind of pain blend.
Joy calls corn mint peppermint on steroids.
Yes, it is. It's wonderful, and it does. It reduces pain, but if you use too much of it, you'll be freezing. I mean, your joints will freeze. So you want to make sure that you blend that appropriately. It's a good pain reliever, though.
And then there are times when you want to bring in heat. Like heat is a really comforting, soothing feeling. My dad used to sleep with a heating pad because he had chronic back pain. But people are more apt to use heat rather than ice. And so there are essential oils then that have that warming effect that you can add to your blends for pain relief.
And you could also use the warming oils if you're going to have someone use ice, because it's a nice contrast. In fact, when you do ice something, you're supposed to do ice, heat, ice, heat, ice. And you're supposed to end on ice, and you're supposed to ice until you're almost numb, because then when the body starts to warm itself, that's when like the healing happens within the muscles.
So Joy, what's one of your favorite warming oils?
Cinnamon bark.
Ooh. I love black pepper. Ginger is really nice and warming too.
Pink pepper is nice and warming. So is cinnamon leaf.
It is. So those are some essential oils that you might want to bring into a blend to either complement that heating effect of using, like a heating pad, or to do, as Joy was saying, to have that alternate heat, ice, heat therapy. These essential oils can also have that same kind of effect, or add to the icing or the heating effect of like a heating pad.
So you would use, so on any kind of inflammation, you would use cooling oils to help cool the inflammation. So if you think of inflammation, you're thinking of things that are swollen, red, hot. So you want to use oils that are cooling. And oils that you would use for heat usually is for people with bad circulation. And so people that have diabetes, neuralgia, things like that in the legs, you would use a warming oil to help warm that up a bit. And then there's it's a great remedy for any kind of pain at all, even internal kind of things like liver stuff and kidney stuff, is using a castor oil pack. This is an old Edgar Cayce remedy, and so if you combine that with the proper essential oils, you really get fantastic results fast. So what you do is you buy some castor oil, organic preferably, and you buy a wool flannel little cloth, a little flannel, little wood cloth, and you soak the cloth in the castor oil, and you also put, let's say you're working, let's say you have pain here. So you put the castor oil on your thigh, and you put the cloth over it, and then you put like a plastic wrap over it, and then you put heat, and you stay that way for about 40 minutes. And the results are, they're unbelievable, to be honest with you. And if you use oils in conjunction with that, you multiply the healing effect of the castor oil. So I would, let's say if I had muscular pain here, what I would do is I would mix into the castor oil that I was going to apply here some lavender, spike lavender, maybe some juniper berry, maybe some anise star, and I would mix that into the castor oil that I was going to apply to me, and then I would apply the pad with the castor oil on top, then the plastic, and then the heat.
For how long?
For 40 minutes. And really that can be done 3 days in a row. And it's magic.
Castor oil is pretty amazing. Some massage therapists even use castor oil in their massage therapy. They really love it because of the effects that it has on the muscles and the joints.
But if you're going to do that, make sure you put a lot of towel down because it's very, very messy.
It is messy, and it's thick. That client that I was talking about earlier with the rheumatoid arthritis, she was actually really, really hopeless and really frustrated. And she also happened to be in the middle of moving. So she was getting ready to move from Florida here to Sedona. And so there was a lot of stress, and there definitely was an emotional component. So I made her an inhaler to address that emotional piece, because she wanted something to definitely apply to the pain, the painful joints and the swelling wherever she had it. But she also needed to sniff something. She needed to smell something that would help her mood and help her feel better and feel happier and feel more in tune with that move. So that's what I did. I made her an inhaler to lift her spirits in a way. And I used sandalwood in that. Sandalwood's a great anti-inflammatory as well.
And it's also great for the brain.
It is.
And so that's what you just don't want to forget. You really don't want to forget the component, the energetic component. And you don't want to ignore the physical component either. Because if someone comes and says, I have a lower back pain, and if you do your intake and you come to the conclusion that the lower back pain really is not caused by an injury, but it's caused because there's a lack of support in the person's life, then you really want to make your attention, you want to have your attention on the that issue, the issue support, the vibrational support of that feeling of lack and feeling unsupported. So, but the person doesn't just want to blend for that, because you don't even know if the person is going to be on board with your reasoning. So you always have to make a blend for the physical, and then you always want to sneak in something for the emotional. And so most of the time when it's a case like that, you give them the blend for the physical, they put it on their back, and whatever that you're giving them for the emotional mostly will either be a diffuser or an inhaler. That is really the blend that helps them heal themselves, instead of the topical blend for the back. And it can be quite amazing. And you could, if you just gave them that back blend, they would still have the pain. It would just become a chronic pain because the emotional wasn't attended to.
A lot of times when we're working with clients, we usually do make them inhalers. I mean, they'll go home with a blend for whatever their issue is, and then an inhaler as well, if they're compliant, if they like to use it. Most people do, and we have these great pretty colors, and we're going to show you some of them at another time. But they make people feel, they really do work and make people feel happy and feel better, emotionally and energetically.
Because the thing about the inhalation, and we'll talk about that in another episode. We'll talk about that in another class. The inhalation has a direct effect on the brain and the mood. In fact, that's really the most powerful way to use aromatherapy is through the sense of inhalation, sense of olfaction. And so if someone doesn't like the inhaler, like the old Vicks inhalers, for those of you that don't know what we're talking about, the old Vicks inhaler, like that, well, these are them, but they're blank. So you could make any kind of blend, you put it on the little cotton stick, you make your inhaler, and then you use that, like that. And so some people, they won't use it. And so if they won't use it, there are other ways that you could help them with inhalation. One is a diffuser, another one is a nebulizer, another one is just to give them a blend to go this way and smell like that. And the other way would be to put the blend on a cotton ball and open the bag and breathe that way.
And don't forget, like I did when I had that tickly cough, just open up the bottle and smelling it. It can really change a person's mood and change a state in their brain and help them just to feel a little bit happier and just to feel a little bit better.
And so if the person feels happier or feels better, that allows the body to heal itself. Because if someone is in emotional pain because of their physical pain, it's just that limbic rat wheel, hamster on a wheel. And so if you could alleviate either one or the other, that helps the body balance, and then the person could heal themselves.
So that basically, if this whole topic is about physical pain, we're really trying to say, don't forget that there's always an emotional component, even to just some physical pain.
Because you can't separate mind, body, spirit. It is absolutely impossible. And if you're just dealing with the physical pain, then what you're actually doing is you're allopathicizing, I made up that word, you're allopathicizing aromatherapy, because you're not using the whole synergistic gift that the oils can give us.
Bella Chica, Are you ready to make a blend now?
Yes.
Okay. We're going to make a really great infusion, herbally infused olive oil now, which we call our anti-trauma oil. So we begin with our empty, I like to use these mason jars, because what's going to happen is we're going to take this after we make our infusion and put it outside. So it needs to be something that's going to be withstanding the elements.
That's how we make it. Other ways that some people make it is they use a crock pot. And we've done that, and it just, it didn't work for us. The feel of it, the energy of that infusion seemed dead, and to me it smelled really funky. I called it poison, even though it wasn't poison.
But sometimes you'll see on the internet that that's the quick way of making an herbally infused oil. But it really is really nice if you have some time, if you have the sun, to put this outside. Here in Arizona, we have many days of sunshine, and we have some nice warm temperatures most of the year, so it's great to put outside. And there's just something magical about the way the herbs, you know, kind of blend and therapeutically just do their thing together when they're outside in the sun.
And so you're saying, well, what if I don't live in a sunny place and it doesn't get that hot? Then, don't you think so?
Like Seattle maybe, or in the Northwest?
Then what you could do is what we did for the winter time here is we bought a French fry warmer, you know, from restaurant supply place. So it has the big heating lamps, and you just put the infusions underneath and you turn it on and you just leave it. For a couple months we do.
It kind of mimics the sun, and it's very slow like the sun when it sits outside. The crock pot method, it's really a quick method that you can do overnight. I like to use gloves when I'm making this infusion because I'm going to put my hands into the flowers, and they're going to go from my hands into the jar.
So these flowers are arnica flowers, and arnica is a good analgesic. It's a good analgesic herb. So when you infuse the arnica into the olive oil, you're getting the analgesic properties of the arnica. And these are dried whole flowers. This could be, we find these work great for us, but you could also use fresh flowers, and that's wonderful too. That's a little tricky though, because you have to know how to work with them, because they'll sweat and they'll get wet, and then the oil gets, and we tried it a couple times, and the first few times it was a disaster. Now we're pretty good at it.
Dried flowers, dried herbs really do work best.
The next one, this is St. John's wort, and usually we use St. John's wort whole flowers. These are not the whole flowers, but in a pinch we find that this works quite well too. St. John's wort is great for nerve pain, so it gives relief to any kind of, for nerve pain, so this is great for sciatica and great for any kind of tweaked nerve.
We have somebody that we work with who has neuropathy, who finds that this anti-trauma oil and the St. John's wort really help her nerve pain.
And it's nice too because they're all together, so you get the properties of all three flowers. The analgesic property from the arnica, the nerve pain relief from the St. John's wort, and then the anti-inflammatory and skin friendliness from the calendula flowers. And those are the last
really
ones.
Pretty. These are the calendula flowers.
And this is how we like to do it. We like to make a, you know, one of those Italian candy cookies with the different colors. That's what this is to me. So we like to do either the arnica or the calendula on the bottom, the St. John's wort in the center, and then the other one on the top. Makes like a little sandwich.
And I'm going to use one of my really scientific therapeutic terms. You just mush and push the flowers in.
And if you leave a little bit of room, then the olive oil goes in a little bit quicker. Okay. So this is olive oil, cold pressed virgin olive oil, organic. We buy it in the big 5-gallon, but you could get it anywhere. Okay, there you go.
Okay.
And so then what you do is you just slowly pour the olive oil into the jar with the flowers into the flowers.
So this is 1 quart of olive oil, and this is a 1 quart jar with the flowers.
See how it's bubbling? And so you see the oil bubble down, bubble down. Sometimes if you make a really big one, we'll make a gallon or 2 gallons. It takes a long time for the oil to bubble down. So you keep adding it like that.
When you're working with herbs and you're working with nature, sometimes you just have to be patient.
So we're going to pull a food channel trick, and here is the trauma oil.
The finished product will come out looking with this reddish kind of a tint to it, and that is actually from the St. John's wort. The St. John's wort flowers impart this lovely red color to the anti-trauma oil.
I'll move that. Okay, so now we're ready to make our blend.
Okay, I'm just going to take these bowls out of the way.
So we have a bunch of oils to make this blend into anti-trauma oil. We are going to make one using Wintergreen, and then because everybody can't have Wintergreen because it's the methyl salicylate precursor to aspirin, so if you have an aspirin sensitivity or on any kind of blood thinners, you don't want to be using it, so we'll give you some substitutions which will work equally as well for a pain relieving blend.
Okay, so this is a 2-ounce bottle of anti-trauma oil. Remember, we're making our pain blend right now. So we started with ply, we talked about ply. And what dilution ratio are we going to use today, Joy?
Well, usually when you're working with an acute pain, that's what you would really use this for, and also chronic. So we're just going to make believe that I fell down and I hurt my back. So we're going to be making an anti-trauma blend for an acute pain. So that would be anywhere between 3 and 5%.
Okay. So how many drops is that?
Okay, I figured out. So if in 1 ounce, to make a 1% is 5 to 6 drops. Correct?
Correct.
So that means in a 2 ounce to make a 1%, I would need 10 to 12 drops. So if I wanted to make a 5% in a 2 ounce bottle, it would be 50 to 60 drops.
That's a lot of essential oil.
That's a lot of essential oil.
The first oil that we're going to use in our pain blend is ply.
Ply is a great oil for pain. Actually, it's almost like a magic oil. They did a study in Switzerland where they took 2% blend of ply central essential oil, and they used it on people that had rheumatoid arthritis, muscular pain, joint pain, and the people in the study were relieved of their pain for 16 hours. We use it all the time.
So I used about 10 drops of ply in that blend. The next oil that we're going to put in is Eucalyptus citriodora.
And Eucalyptus citriodora is an aldehyde. It has a lemony smell. Actually, if you use too much of it, then you smell like bug spray, because that's what it smells like, citronella. But that's why we chose the oil, because of the aldehyde. The aldehyde content is extremely anti-inflammatory and cooling.
I ended up putting 10 drops of Eucalyptus citriodora in our blend. The next oil that we're going to put in our pain blend is peppermint.
Peppermint is a great pain relieving oil.
I like to put peppermint in my blends because it has that cooling effect. And I like that, a lot of people do, they like that icy hot kind of thing. So now we have our ice. And now we're going to add some Wintergreen to the blend.
And Wintergreen is a great pain relieving blend. Wintergreen is made up of about 98% methyl salicylate.
So I ended up putting the 10 drops. So I have 10 drops of everything so far. We have 30 drops total so far in this blend.
The thing about using Wintergreen, it kind of gives it that Bengay smell, and so I personally like the smell. If you're working with someone, or if you don't like the smell, don't use it. And like we said before, if there's an aspirin sensitivity or someone is on blood thinners, Wintergreen is not a good choice to use. And you wouldn't use Wintergreen with children.
So after you've put your essential oils into your bottle of anti-trauma, you're just going to give it a little shake so that the essential oils mix with the anti-trauma oil. And then of course you want to smell it and see what your blend smells like.
That's nice.
Pretty nice.
That's pretty nice.
Yes.
So what if somebody can't use Wintergreen? What do you do?
I brought along 2 substitutions. If Wintergreen is out of your blend for whatever reason, because of the aspirin sensitivity or blood thinning medications or anything to that effect that Wintergreen or birch has, you can choose. Spike lavender would be a great alternative, and so would black pepper. So you can take out the Wintergreen from that recipe and add in either black pepper and spike lavender, or I would actually add in both.
I would add in both too.
So then you would have the 5 oils and then you just make your dilution accordingly.
And then you say, how often should I use it? You should use it 2 to 3 times a day on the area that hurts. And you'll feel better.
So we're so glad that you've joined us here at Stillpoint Online. And we have a lot of fun creating these classes. So if you have any ideas or you'd like to learn a little bit more about something, just drop us a line, join us on Facebook. We have a great group of individuals that you guys can correspond with, and any questions or thoughts or ideas, just drop us a line.
And we love you guys. So come join us and come join Bella Chica.